Between 1916 and 1930, a mysterious disease swept the world. It started with flu-like symptoms, fever, headache, sore throat. Then came the sleep. Victims would fall asleep and not wake up. They'd lie in hospital beds for days, weeks, months, appearing comatose. But they weren't unconscious. Many were completely aware, just trapped inside unresponsive bodies. Some would wake suddenly after weeks and act normally, only to fall back asleep again. Others slept for years, about a third died, another third recovered, and a final third developed a horrifying condition. They were awake but frozen like statues. This was encephalitis lethargica, the sleeping sickness. An estimated 1 million people worldwide were affected. Those who survived often developed post-encephalitic Parkinsonism. They were conscious and aware but couldn't move or speak. In the 1960s, neurologist Oliver Sacks treated survivors with L-Dopa, a Parkinson's medication. Some patients awakened after 40 years of frozen unconsciousness. They'd been aware the entire time, prisoners in their own bodies, unable to communicate for decades. And here's what's terrifying. We still don't know what actually caused the disease. Appeared suddenly, spread globally, and then vanished just as mysteriously. We have our theories of why it occurred, viral infection, autoimmune responses, and we also have some pop culture references such as the latest Sandman series. The pathology suggests inflammation in the basal ganglia and the brainstem, areas controlling movement and sleep. But what triggered it? Sachs documented the L-Dopa treatment in Awakenings. The patients who woke up after decades faced profound challenges. Well, the world had changed completely for them. Their families had now aged or died. Technology, culture, politics, everything was now alien, and the awakenings were often temporary. Many patients developed severe side effects from the medication. Imagine being given a few weeks or months of life after 40 years of imprisonment, only to be locked back in your own body again. Philosophically, encephalitis lethargica raises profound questions about consciousness and the self. The patients were locked in but different from the typical locked-in syndrome. Many retained some awareness but were profoundly disconnected from time and from the world. So the question is, what is it like to be conscious for 40 years without interacting with reality around you? These patients experience time in a way we can't even possibly imagine. Decades compressed, expanded, or maybe absent entirely. The world they knew was gone. They're an alien outside of time. In a sense, they've been erased from history itself and then resurrected. This is the problem of personal identity that Locke and Parfait grappled with. Psychological continuity versus bodily continuity. These patients have both, but with a massive temporal gap. Are you still you if you skip 40 years into the future?